Wuchereria bancrofti. This is a human parasitic roundworm that is the major cause of lymphatic filariasis. It is found in the lymphatic nodes and the lymphatic vessels. Morphology of Wuchereria bancrofti. It is a transparent worm with a smooth cuticle. It is creamy white in color. In females, the tail tapers gradually and is rounded at the tip. In males, the tail curves ventrally. Females are ovoviviparous. The lifespan is 5 to 10 years. Males and females live coiled together and is difficult to separate. Life cycle. Wuchereria bancrofti passes its life cycle in two hosts, that is, the man and the mosquito. The man is the definitive host and the mosquito is the intermediate host. For example, the Culex, the Aedes, and the Anopheles mosquito. Now let's see the life cycle. The mosquito takes a blood meal, that is, the L3 larvae enters the skin. Now it enters in the human stages where they form adults in the lymphatics. The adults produce sheathed microfilariae that migrate into the lymph and the blood channels. The mosquito takes the blood meals, ingests the microfilariae to form smaller larvae of filament worms. Now under the mosquito stages, the microfilariae shed sheaths. It penetrates the mosquito's midgut and migrates to the thoracic muscles to form the L1 larvae. Further, it forms the L3 larvae and it migrates to the head and the pathogenesis. The infection with this parasite is named Wuchereria or filariasis. The disease is of two types. We have the classical filariasis and the occult filariasis. Under classical filariasis, it is caused by the adult worm, for example, lymphangitis and elephantiasis lymphedema. Occult filariasis is caused by embryo, for example, eosinophilia and hepatosplenomegaly. Lymphedema is abnormal accumulation of lymph in the tissue causing swelling of arms, breasts, or genitals. Elephantiasis, the swelling and decreased function of the lymph system makes it difficult for the body to fight germs and infection. This causes hardening and thickening of the skin, which is called elephantiasis. Lymphangitis is inflammation or infection of the lymphatic channel. Diagnosis, which is identification of the nature and the cause of illness. We have direct evidence and indirect evidence. Under direct evidence includes demonstration of the microfilariae in the peripheral blood film, chylous urine, hydrocele fluid, and the lymph varix. Microfilariae appears in large numbers in peripheral blood at night. Hence, the blood film should be made in the night between 10 p.m. to 2 a.m. Under indirect evidence, we have serological tests like ELISA, IFA, and IHA can be used, but these tests have low sensitivity and specificity. Treatment includes antifilarial drugs like ivermectin and diethylcarbamazine. General measures include rest, antibiotics, antifungal drugs, physiotherapy, bandaging. Elephantiasis can be corrected surgically. Prevention and control. Avoiding mosquito bites is the best form of prevention. The mosquito that carries the microscopic worms usually bite between the hours of dusk and dawn. Hence, sleep under a mosquito net, wear long sleeves and trousers, Use mosquito repellent on exposed skin between dusk and dawn.